This treatment for migraines very well could be the difference between 0 and 50%, and I really want to explain why that is. You can treat headaches and migraines on the onset, meaning when they happen, and that's absolutely fine. A ton of veterans do that, but having headaches and taking Tylenol every now and then is not what's going to push your migraine rating from 0 to 10, 30, or 50% whatsoever. And for some reason, a ton of veterans fall into that belief of that category. Now, I have been using gammaCore along with some other treatments, but gammaCore is a non-invasive vagus nerve stimulator. What I'm going to do is actually use this device and record this video so you can see just how easy it is to use. And I want to explain why this treatment is the difference between 0 and 50%. So if you're like me and you constantly get headaches, you're constantly taking Tylenol, and oftentimes those headaches turn into really debilitating migraines, your treatment may shift from treating the onset of migraines to preventative treatments like gammaCore here. And what it's doing is stimulating my vagus nerve here. You can kind of feel it, and it is known FDA approved to treat your migraines. And yes, this matters because all of this treatment talk is hard medical evidence for your VA claim, and I don't want that to go over your head. If your treatment regimen shifts to preventative from onset versus just the onset, that really shows the story of how debilitating your migraine headaches really are. So for some reason, a ton of veterans really believe that taking Tylenol a few times per month and presenting your migraine log is a slam dunk 50% claim. And in reality, it's not at all. Really looking at hard medical evidence like preventative treatments and onset treatments for debilitating migraines, which requires you to speak to your healthcare provider, is much, there it is. It's over just like that. Wipe the gel off my neck here. Boom. But that is really, really strong evidence, and it forces you to speak to your healthcare provider, which is much, stronger than a self-report during a C&P exam. So submitting your timesheets, whatever that looks like for you, wherever you work, your lay evidence, really showing how your debilitating migraines are the cause of your odd work schedule is really, really solid evidence, and that's what pushes your claim from 0 to 50%. We really need to get away from self-reports like migraine logs and personal statements, talking about our symptoms, and rely on hard medical evidence. Now, veterans can lean on hard medical evidence like preventative treatment plans like gammaCore, which is one device of many. There is an issue when the veteran self-reports and the C&P examiner's exam is not lining up, and that's why hard medical evidence is the key. Now, how do you get your hands on this device like gammaCore? So a few things here. One, I'm going to link a live Q&A I did with the representative from gammaCore. We answer every single question under the sun about this device for veterans specifically. Yes, it's free through VA healthcare. Solid, right? In line with VA benefits. But all you need to do is talk to your primary care about your migraines, your headaches, whatever symptoms you have going on, and ask about gammaCore. They're probably going to refer you to a neurologist just to have that conversation with them, because you may need multiple treatments. I am on multiple treatments, not just gammaCore. So I'm prescribed gammaCore to use twice in the morning, twice in the evening. I'm on a nighttime pill, also helps with PTSD, anxiety, and sleep, by the way, but it's mainly for migraines. I take every single night. And then on the onset, I also take, it's another triptan. It's not sumatriptan, but it dissolves in the mouth. And that's like my preventative migraine treatment regimen. All that together is hard medical evidence that's really going to win your 50% migraine claim. And I want you to imagine if I had none of that. I submitted my migraine claim, and all I have is a migraine log going back 2 months, and that's it. And I speak to my C&P examiner about how bad my migraines are, and I'm saying all the right things that YouTube tells me to say, right? Like sensitivity to light, they're prostrating, I have to lay down, my life is so miserable. but yet you're taking Tylenol, and it's just not hard medical evidence. Like truly debilitating migraines are probably going to be a cause for the veteran to seek healthcare, and that seeking healthcare is going to result in a treatment plan, and that is hard medical evidence, which from a VA disability claim perspective is a very, very strong case when you're treating both preventative and the onset of debilitating migraines versus just getting a few headaches per month. And let's not forget about the 50% criteria of economic inadaptability. And so submitting your PTO records, your timesheets, lay evidence from your employment, really talking about your odd work schedule due to your migraines, all of that is solid medical evidence for your VA disability claim. I highly recommend gammaCore, not just for VA disability claim reasons, but mainly for preventative treatments. It's super easy. It's non-invasive. I'm not the biggest fan of medication at all. Depending on what you got going on, triptans go to the kidney. Maybe they go through your liver. You may have some kidney or liver issues. You may not want to explore some medications that's forcing to use those organs there. You could use something non-invasive like gammaCore. Highly, highly, highly recommend this. I'm a big fan of it. And yes, this is my own opinion. Yes, I do have a partnership with gammaCore, but I'm telling you, even without the partnership, I would absolutely still use this. You will see me use gammaCore for months on end, years on end, because it's just a super easy, solid device that truly does. It truly has helped my migraines.